Good morning all, lovely to have you here. I'm Sheena Arthur and I am Partnership Manager for Health and Social Care at Glasgow Council for the Voluntary Sector. So really delighted to be here, and my colleague Lynn has done all the organising and planning, so a big thank you to her. My role is working across the third sector and with the Health and Social Care Partnership, so really delighted to be part of these conversations, really relevant in the work that we're doing. Please do use the chat function. At the bottom of your screen there should be the chat box, so please feel free to introduce yourself, use that if you have any questions for our speakers, and we really want this to be as interactive as it can be. We are recording, so if you'd rather not be on camera, please feel free to put your camera off or to rename, or just to let us know. We're usually recording so that we can share what the speakers are saying, but just if you're not comfortable with that, please do what you need to do to make that comfortable for you. This is our third of our World Reimagined, our social care series, and a really important discussion relating to the Feeley review and what that means for social care and for all of us within it. And really struck so far in the conversations we've been having about the importance of participation and people being heard, and that strong theme about nothing about me without me, and really having people involved in the discussion. And that's why we really want everyone to be able to participate. And at yesterday's meeting, it really struck me, the conversation about social care and how the sector how social care was struggling before COVID, and the significant impact that it's had, and thinking about people's services and how that's been impacted. Some people's services have stopped. People are trying to cope without their usual support, and it really made me think about, you know, who's been there supporting people throughout this, who's been coping and not had a choice about keeping going. No furlough scheme or backup team for our unpaid carers, and it really struck me that we can't have a conversation about social care and recovery without thinking about those, that sort of hidden workforce, if you like. So really delighted today that we're going to have a discussion about the impact COVID and how that's impacted on individuals and families, but also that impact on carers and their perspective. So really delighted we have Janine Rennie joining us today. And Janine is the Chief Executive at Wellbeing Scotland, and really well placed to share insights and experience about how the impact of trauma, the work that Wellbeing Scotland do in a trauma-informed way for a very long time. So Janine is going to share her experience and insight, and we'll have a bit of discussion and time for questions. And we also have Fiona Colley, who is Policy and Public Affairs Manager at Carers Scotland, so very much representing the needs of carers. And I loved on their website a simple phrase, make life better for carers. So delighted that Fiona is also joining this conversation. So I'm not going to waste time chatting when we've got that wealth of knowledge here. So I'm going to pass over to Janine. Thanks, Janine.
Thanks very much, Sheena, and thank you very much for inviting me along here to speak. I think it's an incredibly important conversation to have, and I'm so glad to see so many of you here with a real interest. What's really interesting is that a BBC article came out just this morning, and it was basically looking at some of the things that we're going to discuss today. And some of the highlights there was 3,351 disabled people who were questioned as part of the BBC report, and 2,604 of them said that their mental health had become worse. 2,427 said that their disability had deteriorated, and 683 said all of their appointments had been cancelled or they were unable to attend, with 241 having never left the house at all. To me, that is frightening and significant, particularly in terms of what we were hearing from the people that we were working with throughout the pandemic. We found out that a lot of the people we were working with had absolutely no access to social care whatsoever. All their social care had stopped. And there were people who had been waiting for help, even with looking for a diagnosis of cancer. Their appointments didn't go forward. People had been waiting for appointments. There was an 89-year-old woman who had been waiting for an appointment after a fall and hadn't received that appointment. People waiting for assessment for adaptations to their house, but they didn't have those appointments. And people being put on high levels of medication because they didn't have the appointments there in place that would have avoided that need. So psychology had also closed waiting lists. So a lot of our clients said that they weren't able to then access psychological help. So they said that the online resources that were offered were re-traumatizing towards them, and they didn't want to have to think about their mental health when alone and in the house. So all of these things were things that were raised by our clients. And it made me think about the definition of PTSD. So the definition of PTSD is that people have intense disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares. They may feel sadness, fear or anger, and they may feel detached or estranged from other people. So I reflected a lot throughout the pandemic that a lot of what I was seeing in the people that came to us was the kind of symptoms of PTSD. And the period from March to 2020 is a time that will stay in my mind for the rest of my life, and not for good reasons, obviously. But we were really pleased with the support that we were able to offer people, but I was really concerned about the level of distress that we saw. We were really pleased to be needed, but we couldn't have foreseen how much. So we received calls from people that we'd supported before who were coming in and feeling re-traumatized with what was happening. But I was also really significantly shocked by the level of trauma we were seeing in people who had never accessed services before. A lot of our existing clients called us because they'd received do not resuscitate letters, and they were really frightened. They didn't know if that meant they would be left to die if they caught COVID. We know now that that was not necessarily the case, but people were really scared. And in the BBC article, I saw that that was an issue that other people had experienced. There was a journalist who used a ventilator, and she was told by her doctors that if she caught COVID, she shouldn't go to hospital because the level of care couldn't be guaranteed. So that person then became really frightened about who was going to fight for her, and it left her feeling alone and isolated. Another area that we felt was of great concern was the shielding group. Many in the shielding group required access to a wide range of resources, but the criteria for shielding was really unclear. So a lot of the people that we supported were not on the list for shielding, and it was really confusing. Many wrote to their MSPs to say why they weren't on the list. But really the responses they had when they actually found out where to complain to were really just a list of the criteria for shielding. So, and that was another thing that came up in the BBC article, where nearly 2,000 people told the BBC they had left their house on only a few occasions since the start of the pandemic because they were shielding. Many had to battle for basic support like healthcare, supermarket deliveries, financial support and social care. So often it was the third sector who mobilised, and I was really, really delighted to see the range of third sector organisations who stepped up to the mark during the time and who were going out and putting themselves at risk to make food deliveries to people when they weren't getting the access to support. So that was something where we could see that we were very quickly able to move together as a sector to support people. Like I said at the beginning, one of the biggest concerns was that there were huge waiting lists for mental health services. Prior to the pandemic, they were there, but they became much, much worse. So, and often people just wanted to speak to another human being. We found so many people who had increased in suicidal ideation. We were hearing time and time again people who had completed suicide because they were just unable to cope. And we were really grateful when people came along to us for support. Those with home care services in place had found that their care had actually stopped, or it was sporadic. And a lot of people who were carers could not access PPE to actually support the people that they were supporting. So, and many of the processes were very hard to understand, as they had been before the pandemic. Wellbeing Scotland did many befriending referrals, particularly with people with dementia. And we were working with people where all contact with family had to stop, where the family had previously offered support. And the level of trauma from their loss was heartbreaking to see. And often a lot of carers were going in where they knew and they were terrified that they could be taking a threat to the person that they were caring for, but they just couldn't leave them. So there was real distress and trauma within carers and the people they were caring for. And then when the vaccination started, unpaid carers were not priority for those vaccinations. So we worked with people who had become so distressed that they were unable to access those vaccines to be able to go in and care for the people that they needed to care for. So people were showing really, really serious levels of distress, and we were really becoming concerned about the mental health crisis that was going to come after the pandemic. So many people were finding that they couldn't get access to the support that they needed when they needed it, and people were remaining in a hypervigilant state, waiting for the next wave or variant to hit. The Feeley review is very welcome, as is a national care service, because it will ensure that standards are consistent across care services. However, we must learn from those who use services and those who care for them. If we don't listen to those who are actually needing the support or accessing the support, we won't move forward. It'll just be more documents and more strategies that we want to take forward that don't mobilise into action. So only by understanding what went wrong in the situation can there be change. So one of the big things is if carers and third sector reps are given voting rights in IGBs, that is a necessary and very positive development. I sit in an IGB and I always feel that those in the IGB who have the best input are the carers, the unpaid carers, and the third sector. And I feel that we should have the right then to be able to vote at IGB meetings. I've seen movement and awareness raising of self-directed support. Some of the groups I attend, people who have been in to speak about self-directed support. So hopefully there'll be more understanding going forward. And there needs to be a focus on respite breaks for carers. And I've noticed in my own IGB that's starting to come forward. There needs to be appropriate training for care staff, but also fair salaries and fair working conditions. Families should not have to fight and battle for appropriate care. And there should be consequences for organisations who put people at risk through deficits in care. Care should never be about profit. By expanding and supporting the use of third sector organisations, an ethical approach will emerge. Eligibility barriers were recognised by Feeley. Often accessing personal care was similar to a benefits assessment process, with a lack of dignity, understanding and empathy. Assessments must be person-centred and respectful. They must recognise the wellbeing needs as being as important as personal care. The needs of unpaid carers must have full consideration. If a carer has a job or other caring responsibilities, they should not be expected to fill in last minute because a paid carer is ill. A medical model of care must be reframed into the social model involving empowerment of people. Feeley has recommended prevention and early intervention to avoid the need for crisis support. In the case of mental and physical health, early intervention is absolutely vital to ensure that people do not become so unwell that they need intensive support on an ongoing basis. People should remain cared for at home if possible, and human rights and equality should be at the heart of service design and delivery. It's absolutely essential. The pandemic shone a light on all areas where the system was broken and not fit for purpose. We must learn lessons. In my day-to-day work, I see very serious signs of trauma. The entire world was faced with a virus that could end their life. People experience trauma when their life is threatened. Coming through the mental health crisis that remains will take more than putting in place some online resources. We must learn and we must become trauma informed. And that's me. Thank you.
Thanks very much, Janine. There's a lot within what you've said there, but a really strong message about the experience of people, and actually has created trauma for people, but also has de-traumatized people. And how do we explain that you know, when people, if that's not somebody's usual mode, or you know, decisions have been made about services, you're describing services still not being in place, or the fear that people are living with, and that continued fear. And again, I don't know that people can really understand that if they so how do we explain that in a way? Because it seems to me, unless we acknowledge and understand that, we don't really understand how people can recover and trust. You know, I'm thinking about, if you've not been prioritised as a carer for a vaccine, or you've not been prioritised for the equipment to protect the person you care for, how do you then trust a system to provide what you need? You know, so how do we get that understanding, do you think?
Yeah, I think we need to have a sort of wider training, I think, for everybody working in the field about trauma and the impact of trauma as well. It's about providing personal care, but it's also about providing sort of assistance for people to understand the core conditions of person-centred care. So looking at things that, you know, developing empathy, non-judgmental attitudes, you know, looking at the effects of trauma on individuals. Often people don't understand when somebody's manifesting with really significant anxiety symptoms, what's behind that. So they might look at the kind of symptoms of anxiety, but also not see where that's from. And it may well be that the person who's come in through the door is triggering off a lot of concerns for them, just by their approach. So often, as I mentioned, a lot of assessments are they obviously become really almost like a benefits assessment, where people feel they're being judged. And people become really traumatized by that. And particularly if there's somebody who's maybe struggling because their capacity is being affected by dementia, and they don't really understand what's happening. And quite often that can be really traumatic, but often the level of empathy is not there. So we need to look at the national trauma training frameworks there from the Scottish Government as well that can be tapped into. But also people need to take a responsibility to becoming trauma informed as organisations. And we do that really well in the third sector. But as we're not moving to a national care organisation, which is run by the public sector, I think we need to look at, there still will be other providers there who maybe have a profit-making incentive, and they might not want to put the time aside for that, but it's absolutely essential that they do, that they put the time aside to ensure that people are appropriately trained to be trauma-informed.
So you see that as a need across really all of the workforce, that people are trauma-informed, because any interaction might be triggering.
It could be, and it could potentially trigger in a dangerous way. Yeah. So, and that's what we've ultimately seen, is where people have felt so disenfranchised and so judged, and their dignity has been removed. And often the biggest thing that I see in people that we work with is when their dignity is compromised, that's when they want to actually complete suicide, because they feel they're worthless and they shouldn't be here. And that's something that nobody should ever have to feel. And that's also the vicarious trauma on the carers is huge as well. We often don't recognise that. I'm in the process of writing a presentation for tomorrow on vicarious trauma and self-care. And one of the biggest things that's coming across time and time again is the impact on carers as well. And while that's recognised in people who are paid workers, I think it's often not recognised in the unpaid carers as well, the vicarious trauma that they suffer, particularly during the pandemic, where they were absolutely petrified that they may take COVID to the people they were caring for. And they also had this real fear that if something happened to them, they wouldn't be there to care for the people that they were caring for.
Yeah, absolutely. And that anxiety hasn't gone for, there's a whole group of people who, you know, that anxiety is still very present, isn't it? They're living with that every day.
Yeah.
Yeah, thank you for that. We've got a question from Tracy from Govan Community Projects. I just want to invite Tracy to come in and ask her question before I continue with my questions. Is that okay?
Yeah, sure. I, as well as speaking with experience of working with vulnerable adults, I am an unpaid carer myself and had an awful experience during the pandemic. And I think that I've seen negatives from all care services, private or public sector, but I'm just wondering what people's opinions are on, is a national care service going to resolve much, given that the biggest failings that have happened in Glasgow in social care have been by a care service that's already operated by the HSCP?
Yeah, I think that's a really, really interesting question, Tracy, and that's where I think we need to learn the lessons of what's gone before. And if we don't learn the lessons of what's gone before, a national care service isn't going to fix what's been broken. So I think experiences of people like yourself are going to be absolutely vital. And there needs to be proper consultation and learning from those who have been accessing care in the past and where that care has not been appropriate for what it should be. And I'm hearing loud and clear what you're saying in terms of the failings that have been there. And when you've experienced that, you're not going to want to trust any process because you've been let down so many times. And I think for us to actually make people feel confident, and as you say, even in the public sector, for people to feel confident about accessing support, they need to feel their loved ones are going to be safe within that environment. And if you don't feel your loved ones are going to be safe or that you're going to be safe, then I think you're going to be really not trusting any process that goes forward. So we need to understand that. Everybody needs to understand that, to say that if we are moving forward with a national care service, it needs to be absolutely fit for purpose. And those who are involved in caring and those who are being cared for need to be absolutely at the head of that process. They need to be saying what it needs to look like, and they need to be putting forward their needs and their human rights, basically, to ensure that their human rights are not further compromised.
Absolutely.
Oh, you're on mute, Sheena.
That's the phrase of the year, isn't it? Sorry about that. I can hear Lynn going, I've told her that already. How we learn, I think, is a huge task. And we were talking about this last week. Do we have a sense that, because I feel like a lot of the responsibility is on the people who are living with this, trying to get through, trying to navigate a system. Do you think people have the energy, the strength to share those stories? Is that something that you would see a role? You talked about the third sector being, mobilising and coming together. So how do we, how do we share those stories without further traumatising people? And how do we do it in a way that we trust, actually something's going to happen as a result of sharing this experience?
That is a fantastic point, Sheena, and it's absolutely so relevant, and particularly the fact that GCBS have brought us all here today. I think the role of the third sector is shown is so vital, and you're absolutely right. People are exhausted from consultations sometimes and trying to fight for the support that they need and attending meetings to try and fight. And a lot of people aren't even in those kind of areas because they don't have their voices heard, because they don't feel anybody's going to listen to them anyway, and they feel that nobody will listen, and they're scared to actually speak about their experiences. Their dignity is compromised by speaking out about their experiences. So often the third sector is the area where they can gather the views of those that they work with and take them forward safely. So a lot of the organisations that are here today may be working with people who are in that position, and they can speak to people in a gentle and a safe way, and they can anonymously and confidentially bring forward their concerns. Because there's also the risk that people feel if they speak out, they'll lose any support, or they'll be seen as somebody that's a troublemaker or a problem causer. And often, to avoid people feeling that way, they shouldn't feel that way, but to avoid them feeling that way, often the third sector's got a really important role to bring all those views together, and with GCBS as an umbrella organisation to bring those views in a united way, to show through conversations like this what needs to move forward.
Yeah, and thanks, Janine. That's very much, we will be sharing our learning with our colleagues across statutory services, but I I guess that's a question for people that are here today. You know, would they see themselves having a role there to represent, to share some stories? Because I have heard people say, you know, I'm fed up telling you, and nothing happens with what we tell you. So there's a real responsibility to make sure that when people do open themselves up and tell us something, that we really hear it and do something with it. And it feels like we've got that commitment through the review, but how it actually happens in practice.
Yeah, and Tracy's made a really good point where she said people are exhausted, but speaking from personal experience, I think there needs to be a volume in collaborative voices, as individual voices are not listened to, and a huge anxiety around the impact on the support they're trying to get in place for loved ones. So yeah, there needs to be a loud voice and a volume to speak out.
Yeah, great, thank you. Lynn Corrine has raised her hand. I'm not sure if I'm saying your name right, Lynn, sorry. Has Lynn got a question or a comment to make?
It was actually myself, Sheena. I work at North Lanarkshire Carers Together, and like yourself, our phones were ringing off the hook at the very start and all the way through. And I think we had a discussion this morning before we came on, and one of the issues we found was lots of information coming out through the government, but it wasn't filtering through quick enough to the unpaid carers. So we set up a COVID hub on our website, and then we asked a lot of the carers if they could sign up to e-bulletins. So as soon as we got the information, we were able to get that information out right away. And kind of a lot of the stuff that you were talking about at the beginning about the shielding issues, PPE, not getting a supermarket slot, issues with SDS, the vaccines, the close of services, the halt of services, when services are going to resume, will they resume again? We had an elderly man on to us who had home support service, and he had 2 home support workers coming in to support his wife 7 times a day. So if you work that, that would be 14 members of staff coming in and out his house over a week. That was 98. So the footfall coming into that house was unbelievable, and we took that up on his behalf to try and get regular, consistent workers, so it wasn't a change all the time. So these were some of the issues we were expressing from carers. But what we've been doing is we've been working really well. We've got a carer forum, and it's been up and running since 2019, and the numbers were always sitting roughly about 8. But what we've done is through the pandemic, we've set up on the Zoom platform, and we've found out it's been really successful because carers are coming on and joining us between 12:30 and 2:30. So if they're working at home, or if they've been furloughed, or if you know they're in the homeschooling, they were able to come on and join. And like today, they could come in and dip out when and if they needed to. And we're finding we're getting lots of good feedback from that we're taking forward. We also have a new manager at North Lanarkshire Carers Together who sits in the various strategic boards. So we're now feeding this information through the various partnerships, and hopefully it's going to make a difference to a lot of the carers in North Lanarkshire. But we totally understand, and I think what you said, Janine, everyone in our organisation, we've either been carers or are carers, so we're very empathetic and understanding to carers. And you're right in what you said about repeating their stories. They're fed up repeating stories time and time again. And I think what the pandemic has shown is carers have always had issues and been the forgotten ones, but what the pandemic has done is it's shone a light on the issues and how difficult life can be.
Yeah. No, and I think it's organisations like yourselves that were an absolute lifeline for people through the pandemic. And I've heard that time and time again, where we've sort of heard from people that the carers organisations that were there, they wouldn't have coped without them. And that's something that people need to recognise, that you all stepped up to the mark when you were needed, which I think is so vital.
Absolutely, thanks Lynn, and we've put in the chat if you've got anything that you could share or any you know, progress being made, that would be really welcome. Yeah, Thank you. Janine, there's another question in here. I also want to see if Fiona, please don't wait till the end. If you've got anything you want to come in with, please feel free to do so.
I think I just wanted to say on that point around the third sector. I know that from our early calls, and I've discussed this with Lynn, the level of distress that individuals had, even from before actually lockdown started, because many carers started voluntarily locking down. But that lack of information, that lack of targeted information to say, this is what this means for the person that you care for, this is what this means for you. It was a huge challenge, and I don't think even now it's been completely recognised. I think we are getting better information. We did get better information going along, but getting that out to people and having that front and centre when briefings were happening and things like that. That's how you get information out. You get it out in the media when you're trying to reach that wider population. But instead, the role of the third sector carer centres was absolutely critical in getting that information out to carers. I can't speak highly enough of the work that they did.
Okay, thanks, Fiona. And I think that's important, isn't it, where that we acknowledge and understand what has been really crucial to support people through this, so that we can really see where the strengths are and what's helped people keep going. I'm certainly having that conversation in the suicide prevention work with colleagues within the partnership about, you know, what we think is the front line, if you like, of service delivery and support for the community isn't always the formal service. And I think that's an important aspect of this, people making decisions, being clear what actually helps people, because it's not always obvious. Thank you for that. We've got another question. What do you think Scottish Government and other public bodies need to do as we try to take Feeley forward?
I think when I was reading the Feeley recommendations, one of the things that I noticed was that there was going to be a kind of a board. So there was going to be a board and a chief executive and a structure in place for taking forward the National Care Organisation. And on the back of that, there will obviously be a set of care standards. Now that's only going to be effective. That's essentially a government quango, and it will only be effective if it's accountable and if also those standards are enforceable. So there's a set of care standards in place already, and care organisations are monitored by the Care Commission. That's not led to appropriate levels of care in a lot of cases. So we need to look at really looking at the whole, everything that's been learned by Feeley, all the different feedback that Feeley received about what had gone wrong. We need to understand that. But for this new national organisation to be accountable, it needs to have really strong involvement by the third sector, and the third sector need to be there shaping a lot of what happens, but also holding the National Care Organisation accountable for anything that goes wrong. So, and people need to have a way of actually having their voices heard, which, as we were talking about earlier, are non-threatening and not having to tell their stories over and over again. And, you know, again, when I was looking at the BBC article today, it was really tangible for me that people had to put themselves out in the public eye to speak out about how they'd been harmed. And that in itself is traumatic, to know that you're then splashed all over the press forevermore. So often those who are standing up and having their voices heard really feel challenged by that for a long, long time, and they shouldn't have to do that. So I think for taking Feeley forward, there needs to be really strong involvement. The third sector are massive, and they are the main providers of all of everything. So, you know, they need to really, and often they're the sort of unheard voices when care's being delivered by the public sector. Often the third sector are doing a lot of advocacy and campaigning, but they're often seen as problematic when they do so. So there has to be ways that the third sector can take forward campaigning and having voices heard, without being frightened of their own funding going forward as well, because that's a huge challenge. Often when they speak out about what's wrong, they're scared that the next funding won't be coming through. So there needs to be a way that the third sector can advocate safely without being seen as trouble.
Absolutely. Thanks, Janine, and thanks for bringing that point up. It's really important, and that my role is a new role about bridging that gap and trying to develop that relationship. So very much for me to raise issues and represent the sector and that's really my role. So to be having some of the uncomfortable conversations, but in a way that's constructive. So I see that being one person isn't, going to change everything, but it shows a willingness, to start that conversation, which I think is really important. I'd like to bring Tracy back in. She's got a question, and please don't apologise for having questions. It's great, Tracy. So are you happy to come back in?
Yeah, sure. I was just wanting to ask on the self-directed support has been mentioned, and I'm just wondering what more can be done to make those who are assessing care needs more open to promoting choice and control over care, because self-direction support options aren't communicated as part of it, or that my experience is they are not communicated as part of the assessment process. So there needs to be a more blanket kind of approach that people are made aware of all of their choices at the start of that process, because if you only find out at the end, it's far too difficult to change things. We only knew about it through my own knowledge when we were going through a needs assessment for my mum, and even having said during the assessment 6 times, we want to know, look at all the options. We're being pushed down a road to not take that avenue. So I'm just wondering what more could maybe be done to make sure that all options are, because there'll be many individuals and families who aren't aware that they have that choice.
Thanks, Tracy, and that choice is so important. I'm going to ask Fiona if she wants to come in first on that question.
Yes, I'm continually frustrated with self-directed support because it is a very good policy. It's the right policy, but the implementation has been, quite frankly, terrible in some areas. It really hasn't met people's needs, and some groups, particularly older people, have been completely cut out of it altogether. They're made to think that the only option is a traditional home care service. And we found out during the pandemic there was guidance coming out about more flexibility and self-directed support, basically let people do what was needed. And I think the biggest thing is about assessors actually letting go of control, letting go of their judgment, letting go of what they think is right, and actually self-directed support being, here's a budget, what do you want to do with it? We can help a bit, we can help give you some options, but we trust you. We trust you to do the right thing with your budget to meet your needs. But instead it's layer and layer and layer and layer and layer of bureaucracy. Well, you don't want something as hard as being an employer. It's really difficult to do that. But actually there's some really simple things that can be put in place. But I think the biggest thing is trust, allowing trust. There's too much, and I've heard it in conversations about, we've got to get back best value. We've got to follow the public pound. People who are using services are somehow going to rip it off. That carers, by, for example, deciding to have a holiday with the person they care for as a break, saying, well, no, we can't have that, we can't have that. It needs to be something that really doesn't meet your needs. So I think there's a big thing about letting that go and actually making making it much more about the choice of the individual, and assessors having much less of a role in it. And I think that, I know that sounds a bit counterintuitive, but actually when we get to the point where Janine's saying assessments feel to people like DWP assessments, how shocking is that? How shocking is that that people who need support feel judged in the same way and traumatised in the same way as they feel by the DWP? And self-directed support is part of it, but it's the whole assessment process and how we value and trust people to make the right decisions for themselves.
Thanks, Fiona. And that we've been hearing a lot about we've got the right policy or the right bit of legislation, but the implementation of it has been horrendous. So is it having that trust, or are there other things that you think we should be looking for, so that we don't have, you know, there's a new name, it's the Feeley review, and we do the same things with different words? So is there anything else you think we should really be expecting or pushing for to create that change?
I think there's something about how, when we look at social security, for example, there's a whole discussion about dignity and respect, and actually involving the people who use the services in designing what it looks like, and that needs to be fundamental. It needs to be designed by the individuals who use it, and that's how you start overcoming the problems. If it's designed by professionals, if it's designed by the government, it's not going to hit the mark. It's got to be designed by the people who use it.
Thanks very much, Fiona. Janine, you're nodding. Did you want to come in? Are you?
Yeah, I'm just totally echoing everything that Fiona's saying there. I mean, self-directed support was supposed to be about empowerment, and it's actually not empowerment at all. It's where people are almost having to beg for being able to access that. And, you know, just echoing really what Tracy had said before about how difficult it is to have people to listen to. And I just keep reflecting on in all of our lives that we expect to just plod on and be able to live our lives in a way that we want. So if we want to have to go to the shops, we go to the shops. If we want to be able to go out and get some physical activity, we go out and get some physical activity. Any one of us in life can be impacted at any time by something. And do we not all want that empowerment and respect and dignity in our lives? And why are we in a situation where people do not have that dignity? Why are we in a situation where people are being re-traumatised by a system? And I was totally echoing everything that Fiona said, that those who are affected are the ones that need to design it. To learn the lessons, when I was reading through Feeley, what was coming out loud and clear was people hadn't been listened to, people hadn't been heard, their experiences were disregarded. So any new care service really needs to be shaped and led by those who could be affected. And I think, you know, that's really, really important, even to the point of there should be people with lived experience who are involved in the organisation at all levels to be able to shape that. But again, also recognising that no two people have the same experience, and that's really, really important to understand as well, that one person can't represent the whole sector. So there needs to be loads of consultation with roles like you were talking about, Sheena, that you've got with that interaction between the public and the third sector is going to be really vital going forward.
Absolutely, thanks, Janine, and really building up those relationships and creating a space for uncomfortable conversations. You know, people are living every day with fear, anxiety, as you say, with trauma, with discomfort. So it's a bit of, for professionals and people making decisions to have a bit of that, I think is totally fine, to create respect that we can have those uncomfortable conversations, because if we don't understand that, we're not going to really create a change.
I think Corinne's just raised a really good point about the postcode lottery, and I think that's something that's really important to highlight as well, that people, we work Scotland wide, so people have all got different experiences in different areas of Scotland. So there's no consistency about the level of support that people receive depending on where they live, and that's something that shouldn't be the case, and hopefully a national organisation should address some of that. But we hope that it's been cascaded down to integration joint boards. So if it's been cascaded down to integration joint boards, they're all still locally based. So we hope that there won't still be a postcode lottery in terms of where people live.
Yeah, absolutely. Thank you. I am going to pass over now to Fiona, who is kindly going to give us some reflections. There's a lot to think about, but I'll hand over to Fiona now.
Thank you. I mean, I think it's very clear from what Janine said and the discussion today and the evidence published by the BBC on the impact of COVID that the pandemic has had has huge impacts on some sections of our community far more than others, and I think it really hasn't been talked about. And in fact, I think it's actually been minimised. I'm quite frankly horrified by some of the narrative, and particularly as we move out of restrictions or reducing restrictions, that it only affects the vulnerable. And I know a lot of people hate the term the vulnerable, or people with underlying health conditions. For those individuals and for carers, they begin to feel worthless, that their lives aren't of value. And I think, as Janine touched on around DNARs, that was one thing that was amongst a myriad of things that was of great concern to carers. It wasn't enough that carers were had the responsibility, felt a huge responsibility to keep the person that they cared for safe from an unknown virus. We knew so little about it, and even as we go along, I think it's probably clear we still don't know a huge amount about it. But when news emerged of those blanket DNAR orders and clinical guidance that a loved one might not be prioritised for life-saving interventions, that huge anxiety and fear that grew. And I think my reflection particularly on that is I know that there was quite a lot said by ministers around equal value, but I think a huge amount of trust was lost there, and Janine mentioned trust on a number of occasions. Trust has been lost in some health services. Trust has been lost in GP services, not across the board, and I have to say not across the board, but if your relationship with a GP has been a good one, and then they disappear, and for some people that's what it felt like, your relationship with some health service, be that a CPN, be that a consultant in the hospital, and that stops, you lose trust, and that trust is lost. That could be lost for a long time. If your social care services suddenly disappear, how are you going to get trust back that they'll be there when you need them? I think probably just talking around, I can't describe what happened to carers in any other way than trauma. I can't describe it in any other way. Even before the pandemic, carers faced what was called quite loosely distress. Researchers quite like that term, distress, carer distress, and impacts on their mental health because of their caring role. I'm a layperson, you know, I don't have experience in that Janine has, but I don't think that the impact on the pandemic, but actually the impact of caring, has ever truly been recognised. Research talks about distress, but actually what they mean is trauma. The trauma of the person that you love suddenly becomes seriously ill with sudden illness, like a stroke, a heart attack, a diagnosis of a terminal illness, or a child born with a disability, which is as yet undiagnosed, you don't know what it means. Their life has changed irreversibly, but so is yours. How can you describe that apart from trauma? But it's never recognised. There's a tacit acceptance, and I'm sure Janine would reflect this as well in her work. There's a tacit acceptance that caring impacts on mental health. There's just an acceptance that that happens, and the acceptance that the pandemic has done so even more. But some funding has been provided for online assistance, which has its pros and cons. I remember I used a little bit of the online resources when I lost my dad around bereavement. I found it quite helpful, but that's it's very much different strokes for different folks, and you can't put that forward as the only option. I think we need to start describing the trauma that carers have experienced during the pandemic and the trauma that the people they care for have experienced. Call it what it is. There's additional funding being provided for the mental health and wellbeing of staff in health and social care, quite rightly. You know, there has been an impact on them, and some support through the National Wellbeing Hub for carers. But a lot of the trauma faced by carers is hidden. There's a lot of warm words, and Feeley does this too, about invaluable supports, but little recognition of what the cost of the pandemic has been to carers. There's one thing that I noted in the recent funding about rest areas, rest provision for health staff. But what about rest provision for carers? 3/4 of carers in our survey had not had any break whatsoever, not an hour, not a day, not a weekend, as all their support fell away. Their friends and family they couldn't be in contact with anymore, they couldn't see face to face. And how do we fix that? How do we repair that? The Feeley report, so moving back to what we were discussing in the first place, the Feeley report is a good report. I think it's got some really good recommendations. I think the points about the National Care Service and about that idea of consistency, as Janine mentioned, that idea of rights and specifically redress, accountability. You need to be accountable at individual level and you need to be accountable at national level on what is delivered. But Feeley talks about carers wishing to provide care. It doesn't explore if carers would make different choices and the people that they care for, because I think this is important. You know, we make these, there's almost like somebody's going to provide care rather than if better services and supports were available. Often caring is something that simply just happens. It's part of life. We just stop and say, well, that's just what happens. There's an acceptance in the whole of the Feeley report that carers are just going to carry on doing it. Yes, we'll look at a right to respite. We'll try and tinker about around support and employment. Maybe if we've got better services, it will take a bit of the strain off. But actually, I think we need to explore more what you'd like to see. Now, I can talk. My mum's been ill quite over the last period for quite a long time. If I think about what I want from my mum, I'd like to see befriending and friendship, a transport fund to help her get to the groups and clubs that she used to go to, and to things, practical things like the doctors, the shops, help with things like her laundry and ironing and changing her bed, support to have a holiday and break from the routine, an integrated service that provides her with face-to-face physio and pain management to help her regain her strength, and a simple, straightforward way to have her DLA reviewed on account of her increasing needs. I have spent days and I've not got through to the DWP rep. The package to help her regain her independence, reduce her isolation, so she's feeling part of her community. She might still need family support, but what the National Care Service, what the Feeley report needs to be looking at is how do we help people to live their best lives? And that's really what disabled people were talking about independent living, about being part of their communities. And that's what the National Care Service needs to seek to deliver. I think just sort of finishing up, I think the point about carers having and service users having voting rights on IJBs, I think is a very important one. I think there's a whole a letting go that public bodies need to do. They need to let go of this is a public body, and IJB is a public body. Actually, it's a board of different members. And those different members from the subsector, whether they're or individuals or carers, bring different perspectives, and those must all be equally valued. And this is the way that we move forward to develop the services that build best lives for people. I want to finish just by talking about coming out of lockdown, because I think we're in a bit of a strange position at the moment. We have something around rising caseloads, cases of COVID. We have a new variant. We have what does being vaccinated mean? But there's no recognition at the moment that different people, COVID still presents different risks to different people. But if we don't recognise that and respond to it, and government needs to respond to it, we bake in the trauma for carers. We bake in the trauma for the people who use services. It becomes permanent anxiety, permanent restriction and permanent inequality. And as we move forward, developing health and social care services, as we move forward out of the pandemic, hopefully out of the pandemic, carers, people who use services need to be front and centre, because actually they're a huge proportion of the Scottish population, and they can't be left behind just because a lot of people are quite bored with and fed up with restriction. We actually need to make sure that coming out of lockdown delivers the same experience for everyone, and where support is needed, that's provided. So if Feeley is to be made real, we can't lose sight of decisions made in other policy areas limiting the lives of carers and the people that they care for. I'll finish for that.
Thank you so much, Fiona. That was just, it's hard to hear, but you've put it, you've worded it beautifully, I think, for us all to think about. And I think that point that we really need to describe the trauma, recognising the real impact on people, and whether we think we should have to do that or not. Clearly people don't understand, so we need to be able to do that. And I'm really hearing today the role that we have to create that safe space for people within the third sector, and we're very happy at GCVS to support that, you know, bringing together the voices and that enlarging the voice that was described earlier. So thank you so much. We could go on this afternoon, I think, but we're trying very much to keep to our time. So I want to thank everybody. Want to thank Janine and Fiona in particular, and Lynn for bringing us all here, but to everyone for coming together and for sharing your questions, your input. We have more conversations. We're having a little bit of a break. Our next conversation is the 24th of August, and that's led by our colleagues at Strathclyde Uni, and they are looking at the Feeley review and the need for real co-production. So very relevant to the conversation today. How do we create real co-production, not consulting and asking what do you think about this thing that we're doing, but actually having people right in the mix at the start. So that should be a really good and important discussion. And then on the 8th of September, we have a discussion around social care with motor neuron disease and terminal illness in terms of social care. So we are continuing these discussions. We're really keen to hear from you. If you'd like to, you might want to lead a conversation. You might have people that you think they would really like to be involved. Lynn is doing an amazing job bringing all these wonderful people together. So please do keep having the conversation with us and let us know if you would like to be involved in any way at all. It doesn't need to be like this. And Lynn and colleagues will share the bits of information that have been shared today and recordings once they've been edited.